Capstone Reflection Presentation. Hi, my name is Janny Hansen, and this is my Dixie State ID. I work on a med-surg floor of a hospital. The last 2 years has been hard on all healthcare workers. The COVID-19 pandemic has exceeded the capacity of hospitals worldwide. Healthcare workers have continued to take care of patients regardless of their own risk of getting it, not to mention the way it has affected us mentally. Caring for patients that are severely ill and watching them struggle and die over and over again can cause major anxiety and depression and later post-traumatic stress disorder. We have had to work our normal lengthy hours with mandatory overtime due to increased patient load. We have seen a lot of burnout. Well, what is burnout? According to the article titled Burnout in United States Healthcare Professionals, burnout is a blend of exhaustion caused by unrestrained demands on energy, strength, and resources. This leads to despondency, fatigue, discouragement, pessimism, and ineffectiveness. Burnout among healthcare workers has reached rampant levels since the pandemic started. It can be detrimental to patient care and is a main reason for healthcare workers leaving their jobs. This has definitely been the case on our floor. We have had trouble keeping staff because nurses and especially patient care technicians or PCTs have left due to the amount of stress and suffering they have felt and seen. This puts a huge strain on those of us that are left behind to take care of each patient with less help, and I have definitely felt this stress over the past 2 years. I have watched my managers deal with all of this stress and watching their staff leave and other staff that stayed completely burned out. As I met with my managers for this project, we discussed this problem, especially with the PCTs. They know that many were leaving to find less stressful jobs with better hours that actually paid better. They have been looking for solutions to help with this. They have been trying to think of ways to help them feel more accomplished and happier in their jobs. So this is the area that I decided I wanted to gear my project. To bring this project to life, I needed to select a mentor. I wanted someone who knew the unit well, who was knowledgeable in what is the required education of the PCTs, someone that I felt that I could work with well, and someone who is approachable and willing to help, and someone who is responsible and that I can trust. This exactly describes my educator, and that is who I decided to go with. Through my literature review, I found that helping healthcare workers feel empowered, appreciated, and valued increases job satisfaction. In the article, Prevalence and Correlates of Stress and Burnout Among U.S. Healthcare Workers, they explain that feeling valued is a critical stress mitigator. Feeling valued and appreciated correspond with less burnout, less workload, and increased meaning and purpose. They suggest that workplace empowerment has been proven to increase morale with workers. This benefits the patients as the healthcare workers are happier and more at peace with their jobs. In this article, they talk about a hospital that provides nurses with education, training, seminars, and workshops to increase their knowledge and skills. They found that workers who participate in these have an increase in job satisfaction. This can increase performance growth and aid in less burnout. They have also found that healthcare workers who feel empowered, which includes a sense of meaning, appreciation from managers, competence, and autonomy, have less anxiety and depression and more retention. With this added knowledge and skill set, staff are treated more equally and recognized with their organization. These strategies are crucial in helping healthcare workers feel less fatigue and benefits the quality of service that they can give to the patients. Giving staff growth opportunities and helping them feel accomplished is a key component to job satisfaction and retention. At the end of the day, if a worker can leave with a sense of achievement and feeling confident that they helped many people, they will feel more empowered and feel that their coworkers trust them. I have personally felt this when my manager or charge nurse has put me with a student to work with all day or trusted me to train a new hire. I feel more empowered and feel like they trust me. This increases my job satisfaction knowing that they like me and trust me. Many of our PCTs are in nursing school, and we feel that one area we could help them in is having increased knowledge of certain skills and the importance of them. For example, they are in charge of recognizing and charting inputs and outputs of the patient, but do they understand the reason why it is so important to know these things? Understanding why things are important will increase their knowledge and further help in their studies. The hospital system I work for does a year-long nurse residency program for new nurses to help them collaborate with other new nurses and address some issues that come up throughout their first year as a nurse. There is not a residency program for the PCTs. We decided that I would put on a PCT Skills Day. While at work, I talked to the PCTs and sent out an email to get ideas of what they wanted to learn or have more knowledge in. I have a list of their required education for them, but I wanted to know what they wanted to know. I got great input back with a list of questions they wanted and answered. Here are some questions that they had. How to apply external and condom catheters, and how to empty suction canisters, and how to chart input and output. Why is input and output so important? How to best shower bed rest patients. How often should oral care be done? How often should briefs be checked? What are pressure sores and how to prevent them? What are the different types of oxygen tubing? Are we allowed to change the liters of oxygen the patients are on? Why is it important to check blood sugars before meals and at bedtime? Should we check blood sugars even if the patient is NPO, and why? What blood sugars should be reported to the nurse? Why is it important that we weigh each patient we admit? Why are daily weights important? After talking to my mentor, she wanted me to add in NG tubes, orthostatic vitals, and how to use the bed and bed alarms. These were areas that she noticed needed to be discussed as well. We have some experienced PCTs and some new hires. We decided to highlight a couple of more experienced PCTs in areas that they excel in to help the newer PCTs when they have questions or need help. For example, we have one PCT who excels in skin breakdown. She knows how to prevent it and what creams to put on it. We have another PCT who is very good at prioritization, and another who gets everything perfectly set up when we have admits. By highlighting them, my hope was to give a sense of accomplishment to the established PCTs and help the new ones learn pertinent information for their jobs. My hope was to increase their skill set and help them see how crucial they are to our hospitals and find more job satisfaction and want to stay with us. This will help us retain them and be able to hire even more PCTs to help with the load that is put upon them. This helps me as a nurse because PCTs are very vital to what we do. This is the flyer I hung around the unit to advertise for the PCT Skills Day. These are the goals that I had for my project. I wanted to develop a PCT Skills Day based on their questions and what the hospital system wants them to know. I wanted to help the PCTs feel happier, more needed, and accomplished in their job. And I also wanted to have a positive interaction with management, my mentor, and the PCTs throughout this project. This is my analysis of the project. Here are some pictures of me teaching the PCTs. We met in an empty patient room. We had about 7 to 8 PCTs show up, and some had to come and go because they were working. I talked to my mentor previously about how to get the most amount of PCTs there. When you work full-time and you're in school full-time or work night shifts, it is very hard to get people to come in on their day off for a skills day. She gave me some tips and tricks and helped me to realize that the turnout might not be great. But I was really happy with the turnout we had. We had a great discussion and many questions were answered. There were even topics brought up that were concerns of the PCTs of areas that needed to be addressed. The educator and manager were there and heard these, and we discussed ways we could remedy them. I mentioned those that excel in different areas and who would be great to ask questions to. One of the techs I mentioned was there and seemed particularly happy that I brought her up, and she chimed in and helped teach that portion to the rest of the class. Thankfully, I didn't have a lot of issues or difficulties with this project. Everyone that I worked with was great and very supportive. The only thing that was really hard for me was the timing of it. My daughter is getting married next week, and I wanted to have this project done in early March so that the project and the wedding were not right on top of each other. Because of some other skills days and the Joint Commission coming, we could only do it right before the wedding. This has put a lot of stress on me, but because I had tried to stay organized, it has all worked out so far. With this project, I really wanted to emphasize the why of what we do. I wanted the PCTs to understand the reasons we do them, like, for example, input and outputs. Because if they understand why, they would be more apt to making sure that it gets done. Another small frustration that I had while I was giving my presentation, my educator kept cutting me off right when I was about to explain the why of things, and she explained it instead. But it turned out okay because she explained it to them better than I probably could have, because she's just a natural teacher. This is my evaluation of the project. Here are my goals again of the project. The first one is to develop a PCT skills day based on their questions and what the hospital system wants them to know. I felt like I put on a very successful PCT skills day. There were a couple of other nurses that presented as well. I felt the PCTs learned a lot and issues were brought up that might have not been because it's always so crazy on our unit. Solutions were talked about, and I am overall very happy with how it went. This was a time that the PCTs could ask questions in a safe place, away from the stress of the job. My second goal was to help the PCTs feel happier, more needed, and accomplished in their job. I feel that as I emphasize some of the PCTs and help them all strengthen their skill set and understanding of why we do them, they will feel more empowered, appreciated, and valued in their jobs. Every shift I work with them, I thank them many times for what they do. We really could not run as a unit without them. Their role is extremely important to us, and when we are short-staffed, I definitely feel it. My third goal was to have positive interactions with management, my mentor, and the PCTs throughout this project. I had great interactions with my managers, mentors, other nurses, and the PCTs throughout this project. Our relationships were strengthened, and they got to know me better as I've only worked there 7 months now. This project will help benefit my unit because my mentor is going to use my outline with future PCT skills days that she's decided to do every other month or quarter, depending on when she thinks one is needed. For my own professional growth, this project helped build my confidence. I didn't have much confidence going in because I've actually never worked as a PCT, and I've only been a nurse for 2 years. I felt out of place at times teaching them these things because they actually had more experience in them than I did. As I studied, I learned more in depth about all of these topics, and my knowledge and confidence grew. I also strengthened relationships with my managers, and they got to know me better and see my work ethic. I will need this as I move on to other jobs, and they can hopefully give me good referrals. It also showed me how much stress and pressure is put on management. I realized that I do not want to be in a leadership position, or at least at this time. I want to grow more in my knowledge of nursing before I do that. Throughout this project, I was put out of my comfort zone a lot, as I previously talked about. So I learned to find inner strength and keep moving forward, even though at times it was tough. I also learned to collaborate with many people and learned a lot of organizational skills. This is my conclusion. I found that addressing the PCT's level of burnout is crucial in helping them find happiness in their jobs. Helping them see the significance of their work and feel more valued and accomplished by giving them growth and educational opportunities will allow them to have great job satisfaction, and we will see more retention with them. Like stated earlier, this project will help me in the future with my confidence, organizational skills, communication skills, and pushing through times that are very difficult, as I've had to use all of these skills to do this project. I was happy to have this opportunity to help the PCTs feel more empowered, valued, and appreciated. I cannot yet see what the long-term result of this will be, but my hope is to help them all be happier in their jobs and know that we could not do what we do without them. And these are my references. Thank you for watching.